Let's begin by exploring what Coxa Valga and Coxa Vara actually are. These are terms used to describe changes in the angle between the femoral neck and shaft, known as the collodiaphyseal angle. Normally, this angle ranges from 120 degrees to 135 degrees. When the angle is less than 120 degrees, it's called Coxa Vara. If it's greater than 135 degrees, it's known as Coxa Valga. These changes might sound subtle, but they have significant effects on the musculoskeletal system, influencing how our hips, knees, and even our gait function. Understanding these conditions is crucial for recognizing their impact on daily life and long-term health. Femur is the largest bone in the human body, located in the thigh. It plays a vital role in supporting body weight and enabling movement. The femoral head connects with the hip, forming a highly mobile joint that allows for a wide range of motion. The femoral neck, which sits between the head and the shaft, is where the collodiaphyseal angle is measured. This angle is essential for distributing forces across the hip and lower limbs, helping to maintain balance and stability during everyday activities like walking or standing. Biomechanics of the hip depend heavily on the collodiaphyseal angle. This angle helps dissipate the forces that pass through the lower limbs, ensuring that each structure absorbs an appropriate amount of stress. When the angle is altered, as in Coxa Valga or Coxa Vara, the distribution of these forces changes. This can lead to biomechanical failures, increasing the risk of joint and muscle dysfunction. Proper alignment is key to maintaining healthy movement and preventing injury. Diagnose Coxa Valga or Coxa Vara. Imaging studies are used. The most common method is anteroposterior radiography of the pelvis, often with a slight internal rotation of the hip. Other techniques include computed tomography and magnetic resonance imaging, which provide more precise measurements but are less commonly used due to availability. Accurate measurement of the collodiaphyseal angle is essential for identifying these conditions and planning appropriate treatment. Coxa Valga is characterized by a collodiaphyseal angle greater than 135 degrees. This causes the femur to move closer to the midline of the body. As a result, the adductor muscles become shortened while the abductors are lengthened, leading to a weakening of the adductors. This imbalance can increase the risk of hip and knee osteoarthritis, as well as conditions like genu varum, where the knees bow outward. These changes can have a profound impact on mobility and joint health. Coxa Vara occurs when the collodiaphyseal angle drops below 120 degrees. This leads to a lateral deviation of the femoral neck and shortening of the abductor muscles. The result is often weakness in the gluteal muscles and increased instability of the hip joint. Coxa Vara is associated with a higher risk of osteoporosis, femoral neck fractures, and conditions like trochanteric bursitis, which causes chronic pain in the hip's lateral region. These issues can significantly affect daily activities and overall quality of life. Both Coxa Valga and Coxa Vara can lead to functional impairments in the musculoskeletal system. These include altered gait patterns, limb length discrepancies, and early muscle weakness. Individuals may experience increased lumbar lordosis, genu valgum or genu varum, and other visible changes in lower limb alignment. Such impairments not only affect movement, but can also contribute to chronic pain and reduced independence. One of the most noticeable effects of these conditions is on gait. For example, Coxa Vara can lead to a Trendelenburg gait, where the pelvis drops on the unsupported side during walking. This is due to weakness in the hip abductor muscles, especially the gluteus medius. Such gait abnormalities can make walking difficult and may increase the risk of falls or further injury. Muscle weakness is a frequent complaint among individuals with Coxa Valga or Coxa Vara. In Coxa Vara, the shortened abductor muscles can lead to significant weakness and chronic hip pain. This pain may be accompanied by limited hip abduction and difficulty performing everyday activities. Over time, these issues can contribute to a decline in physical function and overall well-being. Both conditions are linked to an increased risk of degenerative joint diseases. Coxa Valga is particularly associated with hip and knee osteoarthritis, while Coxa Vara raises the risk of femoral neck fractures and osteoporosis. These degenerative changes can lead to chronic pain, reduced mobility, and may eventually require surgical interventions such as total hip arthroplasty. Coxa Valga and Coxa Vara can also affect knee alignment. Coxa Valga often leads to genu varum, where the knees bow outward, while Coxa Vara can cause genu valgum, with knees angling inward. These misalignments place abnormal stress on the knee joints, increasing the risk of osteoarthritis and other injuries. Proper diagnosis and management are essential to prevent long-term complications. In some cases, Coxa Valga is associated with contractures of the gluteal muscles, also known as gluteal fibrosis. This condition involves the tightening of the tensor fasciae lati, iliotibial tract, and gluteal muscles, leading to restricted movement and discomfort. Muscle contractures can further complicate mobility and may require targeted physical therapy for relief. Stress fractures are another concern. Research shows that Coxa Valga is strongly linked to femoral head stress fractures, while Coxa Vara is more associated with femoral neck stress fractures. These injuries can be serious, often requiring extended periods of rest or even surgical intervention. Early detection is key to preventing further complications. Timely diagnosis of Coxa Valga and Coxa Vara is essential for effective management. Early intervention can help prevent the progression of joint degeneration, muscle weakness, and gait abnormalities. Treatment may include physical therapy, lifestyle modifications, and in severe cases, surgical correction. The goal is always to preserve function and improve quality of life. Conclusion: Coxa Valga and Coxa Vara are more than just anatomical variations. They have profound effects on the musculoskeletal system, impacting everything from muscle strength to joint health and mobility. Ongoing research is vital to deepen our understanding and improve outcomes for those affected. Raising awareness among healthcare professionals and the public can lead to earlier diagnosis and better management, ultimately enhancing the lives of individuals living with these conditions.